All right. Hello, everyone. My name is Alex Sorotsky. I'm a public health educator with the Washington Poison Center. Today, I'm joined by Dr. Scott Phillips, the medical director of the Washington Poison Center. Now, while Dr. Phillips and I are both in Washington, right now, we're wanting to spread awareness for all poison centers or poison control centers. They're all the same thing. We all do the same work. Now, in light of this year's National Poison Prevention Week, which is March 20th to March 26th, we decided to put together a short overview video to highlight some of the unique ways that we can assist emergency medical technicians and paramedics. Thank you for joining today, Dr. Phillips.
Hey, thank you for inviting me.
All right, well, let's dive right in. So, question number one is, why should first responders like EMTs or paramedics contact poison control?
That's an important question that we deal with all the time. And I want to say that as a former EMT myself in my early years, there's two great reasons to do this. And one is to get information before you get to the scene. And two, that we might be able to help you with treatment of that patient.
Perfect. So can you speak more to both of those? Like, what are the more specific ways that poison centers can help?
Sometimes the patient will have some complex medical conditions. They might have an unusual drug. They might have taken a plant, a mushroom, or something else that the EMTs or paramedics are not quite familiar with. And we can give them information before they even get to the scene, while they're en route to this call, of what they might be looking at or what they might be expecting to see. And then after the EMTs and paramedics had a chance to assess the person, then they can call us back and we can give recommendations about what they might be seeing, whether it's related or not, and if there's any specific treatment that we might recommend for them before, during their transport to a hospital.
Awesome. That's really, really helpful to know. So what for any EMTs or paramedics who are watching this, which I hope you all are, what information do poison centers need from them in those kind of calls?
One of the things that Poison Center do is we collect patient information, and a lot of that is to study poisons and how they affect the country nationwide. And our data is aggregated ultimately by the Centers for Disease Control. And so we do ask for certain information, partly because it helps us help you on the scene of a patient, and that would be age, gender, what they may have gotten into, how they took the medicine or had the exposure. Did they eat a mushroom? Did they rub a plant on their skin? Did they take pills? That type of thing. So we want all that kind of information, but the name and age is important so we can follow these patients, because we will follow the same patient even after the first responders finish working with them. We follow these cases through the hospital system as well, sometimes as long as discharge. So we like to be involved early on. We can have our greatest impact in the first few hours, and that's really important that we have that information up front.
Perfect. Now, how often do poison centers actually receive calls from these first responders?
It's actually very common. And I know our poison center in the Pacific Northwest, we have a dedicated phone number for first responders to call. So we can, they don't have to wait in the phone queue. They can get right through the back line to us, and you can get great information. And so it happens frequently enough that we have a special way for them to do it. And so we encourage you to contact your regional or local poison center and find out if they have a similar service with a backline number for first responders to call. It's very efficient.
Perfect. Now, I think a good way to round out is to walk through just some common types of calls. What are some common calls you're aware of from EMTs and paramedics?
Well, there's all kinds of uncommon things that happen, and there's a lot of common things that happen. And of course, we're all familiar with seeing someone who maybe takes an heroin overdose. But that may change, for example, if it's a fentanyl overdose, on how they respond to Narcan medications, for example. We might tell you to use a different nostril, or to use both nostrils, or to give repeated doses. So those are common kind of questions. Gee, they had a little bit of a response to Narcan, but not always. We might also tell you to do certain things on certain patients, as far as sometimes it's common that people will try to make their family member throw up, and oftentimes that can cause more trouble than you're trying to successfully treat. And so we can give that recommendation, and so that's a common call. But oftentimes it's us getting information to you early. It's this particular medicine is known to cause slow heart rates and low blood pressure. This is what you have to be looking for. This is what you have to be ready for. And it really helps the first responders prepare for that, so they may put IVs in a little earlier. They might be ready for things. And it's very helpful for them. So we get a lot of calls, and from common things to very unusual things.
Perfect. Well, I think that was excellent. Thank you so much, Dr. Phillips. And to any first responders out there watching this, please keep us in mind as you need. We're always here to help. And for any non-first responders watching this, you can always contact the Poison Center. We're happy to help. We're always open. And our number, the general number is 1-800-222-1222. Thank you all so much.